My full name is Godensia Salesti. I am a student from 2019 B. And now I will explain about understanding coronavirus. In the United States, the coronavirus began with an outbreak in Washington state. Over time, became an epidemic, which was an outbreak. That means the number of people who had the virus continued to rise rapidly. Pandemic is a global epidemic. This means that the number of steps continues to increase rapidly throughout the world, no longer in one region or one country. It grows various regions of the country and districts. In the United States, the epicenter of the coronavirus outbreak is a nursing home in Washington state. Next, response to the coronavirus. When the coronavirus moved from the epidemic to the epidemic and then to those of us who have responded differently, one of the first things, namely restriction. Restriction are where to control someone or something. For example, there are currently many travel restrictions around the world. Then the second, respond to the social distancing. There is a focused effort to reduce the contact between people, and the goal of social distance is to slow down the movement of the coronavirus. This is why schools are closed, major public events are canceled and closed. The other response we often hear is quarantine alone. The word quarantine means suppressing and limiting the movement of people who have the virus because they have been exposed to it, and those who have not. And finally is isolation. Isolation is when someone individual with a disease have been completely separated from other individuals with a disease have been completely separate from other individuals when they are contagious. Infectiousness refers to how a disease moves or spreads from one person to another beforehand. And three important reasons why we do that. First is to protect us and everyone, and the second is to protect those who are most vulnerable. Now, with the spread of the coronavirus, it seems the people who continue to age are people of the elderly age, and people with compromised immune systems are the most contained. And the third reason to slow the spread of the coronavirus is to reduce the possibility of excessive overstressing or overload. Overburdening. Overburdening is a healthcare system in a hospital. In hospital, there are doctors, nurses, all medical staff, and facilities that can treat all people. Need medical care, so we need to know to talk with doctors, nurses, and other medical staff about how the symptoms are experienced. Some of the most commonly discussed symptoms are fevers, which is when the temperature is too high, and maybe we have other cases of coughing. We may experience cough, shortness of breath, or chest. Next is worry of coronavirus. Body pain is when your whole body hurts. You may also feel tired and lethargic. Means for tired and lethargic mean you do not have allergy. And the last is how we prepare ourselves to stay at home or to talk about the social distance of choosing to stay or even if you need to quarantine yourself. The fourth is inventory. Inventory means having additional supplies, especially basic needs such as food, medicine, and other important household items. And this is very appropriate if you are going to quarantine yourself for 14 days. That means that you need to have enough food for you and anyone who live with you. So now, how many people uh, go to grocery stores and other market to buy things like dry food, canned goods that are not easily damaged, and frozen food? Dried or dried or not perishable items are long-lasting food such as rice, peas, and dried beans. Now, again, this is very appropriate and even smart to do. Hoarding means having extra large supplies that you keep for yourself. If you stockpile inventory, that means you are taking more than the unit, and as a result, other people do not have the opportunity to save and prepare, and that is something we definitely want to avoid.